morning, students. So, let us continue with the remaining part of the topic, human health and disease. The next concept is about immunity and immune system. This immunity and immune system is very complex process that works in human body to protect these individuals from getting wide varieties of simple diseases or chronic diseases also. So, here first we need to understand what do you mean by immunity and why we require this immunity for betterment or for the normal life. So, immunity is one of the system that is going to fight individual body against any pathogens, because in this environment each and every organism they want to survive. It is a matter of survival. When they involved in the process of survival, some they lead their life without harming anyone, but some of the organisms, as they belongs to those category, if they want to survive, definitely their survival factor is going to harm some other organisms. If you take an example of pathogens, pathogens are the group of microorganisms which are going to cause disease. They always try to find out abundant nourishment or source of food, and this abundant nourishment they will get very easily from the human body. So, if you ask a question, what happens if these pathogens enter into the human body? Soon, once they enter into the human body will start getting diseased symptoms. Means his body cannot perform normal physiological activities. Then only we call that the person has got a disease. So, meantime, a human body will also strike against preventing these pathogens. That system is nothing but a immune system. Immune system is a state of resistant, or it is a state of resistance against disease. This is very fantastic concept that we will understand how fantastically our body has been framed both physically and the physiologically, and how our lifestyle or the nourishment or the food or the healthy lifestyle is going to decide our overall health. So, this immunity is basically classified into two types, that is innate immunity and acquired immunity. Innate immunity means immunity that you will get soon after the birth, and acquired immunity is a type of immunity you need some time period of growth, then only you will get that immunity. Means a baby will never going to have this acquired immunity. Soon after birth, what type of immunity that baby used to have? Only innate immunity. Once it completes the age of 6 or 7 or 8 years, then a baby body or he or she, they will start getting the acquired immunity. Acquired means we get it after reaching certain stage of growth. First, let us discuss in detail about innate immunity. Okay. Innate immunity, as I told you before, it is one of the immunity that you will get soon after the birth. It is one of the protective mechanism. Okay. And it is also known as non-specific type of immunity, because their reactive nature is not specific towards the specific microorganism. It reacts against wide range of microbes like virus, or it may be bacteria or the fungus or any type of helminthes or protozoans, any category. Their reactive angle is wide and it is not specific. So, innate immunity is known as non-specific immunity. And you may get a question, this immunity always differs from person to person. This is important or the interesting concept that where you need to focus. Why it differs? Because all of us, we belongs to the same species, that is Homo sapiens. But even though their strength, their genetical characters, what are the characters they borrowed from their parents, from the gametes in the form of gametes, and how better they are nourished, and how better they are following the food pattern, and how active lifestyle they are following. Active in the sense both mentally and physically. A state condition or the static condition is not suggestible for the human body. Always he has to meant for any type of the creative activities and involving themselves in any type of physical activities like playing any type of game or sports or running, jogging, yoga, or any type of physical activities. And these all factors decides their individual innate immunity. And here, that is the reason it differs from person to person. Innate immunity has got the 4 barriers. First, physical barrier. Second, physiological barrier. Third, cellular barrier. Next, fourth, cytokine barriers. These barriers, their presence itself is going to prevent the entry of microorganisms or the entry of pathogens into our body. So first we will discuss about physical barrier. Physical barrier, as the name indicates, their presence itself is going to create a barrier against a pathogen. So physical barrier is also known as first line of defense. Okay, here we come across like skin, mucous membrane, or any type of mechanical actions we do. Okay, first we will discuss about skin. Skin is the outermost tough impermeable barrier, and this skin is going to consist of the fibrous protein known as keratin. And whereas the mucous membrane is one of the membrane that coats the many of our organs like the respiratory pathways or gastrointestinal tract, urino-genital tract. All these tracts, why they are coated by this mucous membrane? The presence of this membrane is going to trap the any type of pathogen if they try to enter into our system very easily. So that is the reason the mucous lining or the mucous coating in these regions is very important. It's a type of the barrier that we come across. Whereas the physical part or the mechanical actions we come across. So mechanical actions like movement of your eyelids, coughing, sneezing. Okay, so all these types of movements that we come across in our daily life, it's a type of protective mechanism. So once if any dust particle tries to enter into our system through nose, what we feel exactly? So we start feeling sneezings, or if any microorganisms or any pathogen they tries to enter into our gastrointestinal tract through the mouth. So what we feel? We start feeling coughing. So that is how it is also a type of a protective mechanism that is included in the physical barrier. And next comes to physiological barriers. Physiological barrier So here their content secretion itself is going to protect, or it is going to act like a barrier for the pathogens. Barrier means, so it's a one word which explains preventing, which prevents the entry of pathogen. First, in case of HCl in stomach, as we have studied in the first year, the HCl, hydrochloric acid secretion from the gastric gland, that is that takes place in stomach. The initial purpose of the HCl is to support the digestion process, but meanwhile HCl acidic environment which creates the pH around 1.5 to 2 in the stomach, it will also prevent the growth of or the entry of the pathogens through your gastrointestinal tract to the stomach region. And whereas saliva is also very important barrier, physiological barrier it is considered, because saliva that mainly contains antibacterial enzyme known as lysozyme, and this lysozyme that is going to act like an antibacterial enzyme, or it is going to kill the, or it is having the property of bactericide. Bactericide means which kills the bacteria, and that is the reason even though when we are roaming here and there by keeping your mouth open while or having or chewing something or while talking with your friend, then also will never get the infections very easily. That is mainly because of antibacterial enzyme, that is lysozyme, present in your mouth. And even the next part is about tears. So whenever any dust enter into your eyes, so you can see immediately tears starts roll down. Why it happens? It's mainly because of type of protective mechanism. That salty nature of this tears is very important for removing or the any type of dust particles or any type of pathogens. If they tries to enter into your eyeball, that will be removed very easily. So what happens? So here the salty nature of this tears is main purpose is to kill or to prevent the entry of any unwanted components. Next, in case of sweat, they are also known as sudorific glands and oil gland, which mainly it is also known as sebaceous glands. All these sweat or the oil glands, they are mainly placed in the skin. Okay, whether it is a sudorific glands or the sebaceous glands, these secretions has got an antiseptic effect because they contains lactic acids and fatty acids, and this lactic acids and fatty acids are bactericidal and fungicidal. So generally what we do, you may come across some of the person's skin, it differs from person to person. Okay, what we do, so we start feeling somewhat uneasiness if your skin is a bit oily in nature, and what we do, we start applying some creams on the face or some creams just to prevent the secretion of the oil or to look somewhat glowing skin. So that is the part of your beautiness, but basically that we should not do. What happens if you are going to apply the creams on the skin? So these pores will be closed, means you are intentionally you are suppressing your immune system, and that is the reason easily to such persons will get the wrinkles and the pimples and all those things happens to them. So that is how that is sudorific glands or sebaceous glands, they are going to prevent this bacteria and even fungus. So that is the reason it is known as bactericidal and fungicidal. And even though removal of sweat is very important for our system to releasing some unwanted salts or unwanted nitrogenous contents produced inside our body. Okay. Next, is about cellular barrier. Cellular barriers, they are also known as second line of defense. So what they do, first line of defense is, that is the skin and all these physiological secretions like saliva, HCl and all those. Second line of defense is the cells which are placed inside our body, and which is the or the fluid tissue we come across inside our body, obviously blood and lymph. And all these cells, they are placed either in blood or in lymph or in some tissues like WBC cells, white blood corpuscles, neutrophils or polymorphonuclear cells, then monocytes, lymphocytes, macrophages. All these cells, they are placed in blood, okay, some of them in blood and some of them in lymph and some of them in tissues. What is their main purpose? Their main purpose is to prevent the entry of unwanted microorganism that is going to damage your system. And each of them, they are going to react in their own way. Okay, some cells, they are going to do the phagocytic activity. Phagocytic means engulfing the foreign particles. And some cells, what they do, they release some chemical content against the pathogen or against the foreign particle that kills that pathogen. So that is how their reacting process is totally different, but their purpose is same. All of the cells, they tries to prevent or they tries to kill the any type of pathogens they tries to enter into our system. Okay, and the next barrier, and the fourth one is cytokinin barriers. Cytokinin barrier, I think this is a new word we are coming across. Cytokinin. Cytokinin. So in order to understand this part, I will tell you a small story regarding or the situation how we react whenever we face some threat. So when you start facing threat from any person, what we do? Immediately we start producing the loud voice, like calling someone, help me, help me. So why we do? So that is the alarming call for some person who are ready to help you. That is how, when you come across any situations like you are not able to do, you are not able to handle that, at the time definitely you need to get help from someone where they are near to you. At the time we start producing a loud voice like help me, help me. It is a symbol of alertness of the persons who are staying near you or in and around you. So that is how some of the cells also going to produce that alarming sequence or the alarming response when they will get the infections. So in case of cytokinin, when any cells they will get infected by these viruses, they start producing the cytokinin content known as interferons. They may be interferons or lymphokinins or tumor necrosis factor. This tumor necrosis factor that we come across in cancer cells, okay, whereas lymphokinins that are produced from the lymphocytes. So that is how all these interferons, lymphokinins and tumor necrosis factors, they are classified under cytokinin. That is a type of response the cell is going to make, alarming call for other cells to be alert. So in turn, these cytokinins, it is also going to protect the non-infected cells from the viral infection. They will prepare themselves to face the situation. That is how the cytokinin barrier is also going to do, because this cytokinin in some of the medical cases, this is very important. Okay, if you are having any type of the symptoms or the suspect of any type of infections and all those, so doctors, what they do, they just collect the blood and they'll just go through any type of cytokinin secreted inside your body or inside your blood. Then he can say, okay, there is a chance of initial state of infection. So that is how they are going to deal with some of the disease. So, my purpose is to say that cytokinins are very important for doctors in case of medical field to treat you in case of wide varieties of the infections. Okay. Okay, thank you students. By this we are done with this only the innate immunity part of the topic. Okay, the remaining part will continue in the next slide. Thank you.